sobre manejo y medicina en reptiles. ¿Sí? El día de hoy es un honor tener con nosotros al doctor Douglas Mader. Les voy a leer su semblanza curricular previa a darle la bienvenida al doctor. El doctor se recibió de médico veterinario en la Universidad de California, Campus Davis, en 1986. Cuenta con una residencia en medicina de animales de zoológico y primates en la misma institución. Es el veterinario consultor del Monroe County Sheriff Zoo, del Key West Aquarium, del Dynasty Marine, del Sea Turtle Hospital, del Everglades Alligator Farm, del Key West Butterfly Conservation, del Key Deer Refuge y del Theater of the Sea. Fue dueño del Marathon Veterinary Hospital, que es un hospital de 24 horas de referencia que recibía numerosos alumnos de igual forma de esta universidad. Es ponente internacional y pertenece a la junta revisora de numerosos journals científicos. Además, ha recibido diversos reconocimientos, incluyendo the US Fish and Wildlife Conservation Award, el premio Fit L. Fry y el premio UCD SBN. Ha publicado numerosos artículos en journals científicos nacionales e internacionales, además de ser el autor, editor y coeditor del famoso libro Reptiles, Medicine and Surgery. Su última publicación es llamada El veterinario en el Arca de Noé, historias de supervivencia en un hospital animal en medio de la ciudad, que justamente es el libro que vemos al costado derecho del doctor Douglas. Entonces, sin más preámbulos, le damos la más calurosa bienvenida a la FES Cuautitlán, al doctor Douglas Mader. Welcome, Dr. Douglas. I have already done your presentation. Now you can share your presentation, please, and start whenever you want.
Okay. Buenas tardes, amigos. Mi español es muy malo, so yo hablo en inglés. I will talk very slowly. If you have questions, let the host know, and then we'll make sure we answer them. Thank you very much for the invitation tonight. We'll spend the next hour talking about something very important, and that's antibiotic therapy. A lot of what I am going to say can be applied to dogs and cats and birds and other animals as well. Antibiotics are a big issue here in the United States, and they are probably in Mexico too. And one of the problems that we have with antibiotics is that they tend to be overused. And as a result, a lot of the bacteria that we used to be able to treat are no longer sensitive to the antibiotics. And so in the United States, there's a new movement called stewardship. And what that means is the regulatory agencies really don't want us using antibiotics unless it's absolutely necessary, because we don't want to be selecting for antibiotic resistant bacteria. So what I'm going to share with you tonight is extremely important. Let's go back to the basics. I'm going to talk about some things that are very important in order to let our antibiotic therapy be effective. The first thing we have to remember is that reptiles are ectothermic. What that means is that they control their body temperature from the environment. So if it's warm out, they're going to be warm. And if it's cool out, they'll seek places where they can bask in the sun so they can warm their body temperature up higher than the local ambient temperature. Why is that important? It's important because there are 13,000 different reptiles out there, and every one of them have a different, what's called the preferred optimum temperature zone. In other words, what's good for one reptile may not be good for another one. If they're too cold, they can't metabolize the antibiotic. If they're too hot, then their body starts to break down. So they have to be in this middle range. Here's a couple examples. A gopher snake, which is a very common snake in North America, has a preferred temperature range from 22 to 31 degrees. But the green iguana, which is something that you're all familiar with in Mexico, has a range from 30 to 40 degrees. So obviously the iguana has to be kept much warmer than the snake does. And each reptile has a very specific range that you need to keep them in when you're treating them. There were some very interesting physiological studies done with the desert iguana, Dipsosaurus dorsalis, several years ago. And what the researcher did was he put these animals in a large room, and the room was cold on one side and it was warm on the other side. Then they measured the temperature of the iguana and they determined where it preferred to be. So it would pick a range right in the middle. Then they gave the iguana a pyrogen, and a pyrogen is a disease that can cause an animal to have a fever. So in this case, they gave the iguana salmonella, and then they monitored the behavior. Every single instance after they gave the salmonella, the animal picked the warmer side of the cage. And that's called behavioral fever or thermoregulation. And they did that so that they could get their body's immune system stronger. I did a study, I published it many years ago, where I looked at different bacteria and I compared the 6 snakes with their bacteria at 25 degrees centigrade versus 37 degrees centigrade. And what you need to notice is that when the animals were kept warmer, every one of them used 1/2 to 1/4 as much antibiotic to achieve the same result. So not only does warming up the patient help their immune system, it also helps them so they don't need to use as much drug. There are many ways you can warm them up. Here's an example of a room. The entire room is kept at about 34 degrees centigrade. And in this side over here, each cage has a different temperature in it. So like this snake is a different temperature than this iguana, which is a different temperature than this iguana over here, and a different temperature than this snake up here. So each snake and each lizard can be kept at the temperature that's appropriate for that species. Here's another example. So I did a study a few years back where I looked at iguanas and I injected them with a radio contrast material called iohexol. So I injected this iguana in the muscle at 26 degrees centigrade, and I injected this iguana in the muscle at 32 degrees centigrade. And I wanted to see which one would absorb the quickest. Well, at 28 degrees centigrade, it took 3.5 hours for the contrast material to start being absorbed. But at 32 degrees centigrade, it only took 45 minutes. So basically, warming that animal up just 6 degrees centigrade, the drug absorbed almost 4 times faster. So why do we warm them up? We warm them up because it helps their immune system. We warm them up because you don't need as much drug, and you warm them up because it absorbs the drug much, much faster. So keep them warm. That's the key. If you remember nothing else from tonight's lecture, just remember when you're treating sick reptiles, the most important thing you can do either in your hospital or when you send them home with your clients is they have to be kept warm if you want them to get better. Okay, so how do we choose which animals need to be treated and which ones don't? Well, obviously the isolate of the bacteria and the source. So if I get salmonella out of the bloodstream, I'm going to treat that. If I get salmonella from the gastrointestinal tract, I'm probably not going to treat that because salmonella normally lives in the gastrointestinal tract of reptiles. The type of patient that we're treating. It might be very easy to treat a pet iguana. It may not be so easy to treat a large crocodile. The availability of the medications. Where I live on a small island right now. We don't have a lot of pharmacies. So sometimes I may need a drug, I can't get it. So there may be drugs that are good to use, and there may be drugs that aren't as good, but are easy to get. So sometimes the availability of the drug will determine whether or not I treat it. The experience of the clinician. I'm comfortable treating a spitting cobra, but if you've never done it before, maybe that's the case that you should refer to somebody else. And then finally, is the patient ready to be treated? What I'm talking about, of course, is are they warm? It's the rare rare reptile patient that can't wait 12 to 24 hours to be warmed up. The other thing is, make sure before you start treating them with drugs, antibiotics, that they're properly hydrated. So make sure you warm them up, put them in an incubator overnight, and get them on hydration, get them on fluids. You can give them oral fluids, you can give them IV fluids, you can give subcutaneous fluids. And I like any crystalloid like lactated ringers or sodium chloride, 20 mils per kilogram per day, orally, subcutaneously, intravenously. Okay, so warm your patients up, make sure they're properly hydrated before you give them antibiotics. Otherwise, the drugs won't work. There's a very old saying, if the mouth works, use it. A lot of people are afraid to give oral antibiotics and oral fluids to reptiles. Well, if you warm them up before you give them the fluids, they're going to do just fine. So make sure they're warm, get them on proper fluids, then you can start treating them. Now, as I mentioned, some animals are more difficult to treat than others. So this little lizard here, very easy to treat, very safe. This large python, the teeth are so long, they penetrated the lower jaw and bit into the person's finger. So if the mouth works, use it, but only use it if it's safe to use. Sometimes in this tortoise, it's very difficult to open her mouth. So it's okay if you need to put in feeding tubes. This way you can give fluids, you can give antibiotics, you can give food. It makes it easy to give in the hospital. It also makes it very easy for the owner to give at home. So make sure that your patient is prepared before you start treating it. There are many different types of antibiotics that we can use, and I'd like to go ahead and talk about some of the different ones. Topical antibiotics have a definite place. Now, I know you can get a drug like this in Mexico. This is called silvadene cream, also known as silver sulfadiazine. This is really important. It's used in human medicine for a couple different things. Most importantly, it's used in burns, patients that have been badly burned, 2nd and 3rd degree burns. Silver sulfadiazine is an excellent topical antibiotic for gram-negative bacteria, specifically Pseudomonas, which is one of the most common bacteria that we see in reptiles. It also, because it has the silver in it, is very effective against fungal infections. Frequently in burn patients, when they're getting bandage changes every day, they get fungal infections under the bandages. So in humans, they put silvadene cream on the burn wound, and that treats the Pseudomonas infection. It also treats any potential fungal infection that they may get from the actual bandaging. So here's an example of a snake that's getting treated with silvadene cream for a burn. This animal got burned on a heating pad, and it's got 2nd degree burns. You can see the blisters, you can see the bleeding. And so you can take the silvadene cream and rub it all over this burn, and do that every day. So you can clean the burn with soap and water, rinse it off, and then apply the silvadene cream. And that's a great way to penetrate and treat the burns. Now, silvadene cream is so safe, you can actually use it in the mouth. So this is a snake that has Pseudomonas infectious stomatitis, also known as mouth rot. So because in the mouth, when you have a lot of inflammation, you may not have good blood supply. Systemic antibiotics may not be real effective, but you can take silvadene cream, which is good against gram-negative bacteria, and you can apply it directly to the mucous membranes. Now, what's nice about this cream is that it has a pH of 7, and it's water soluble. So if the snake swallows it, it's denatured in the stomach, and it won't cause any dysbiosis, or it won't upset the intestinal tract of the snake. So you can use it directly in the mouth to treat the infection in the mouth. Another example of topical treatment is taking cream or drops, in this case gentamicin, and putting it directly in the nostril. This animal has a sinusitis, has a bad infection in the nose, and the nasal cavity is one of the areas that has very poor blood supply. So if you give systemic antibiotics, frequently you can't get a high enough concentration in the nasal cavity for it to treat effectively. So what you do instead is you just take the antibiotic and you squirt it up directly into the nose. Now it'll spread out through the nose, up into the sinuses, into the ethmoids, and achieve a high concentration at the target site, which is in the nose and in the sinuses, and it allows more effective treatment. For injectable antibiotics, there's a few things that you should know. Definitely, we talked about having them warm because I showed that if you inject them at a warmer temperature, it's absorbed much quicker when you go intramuscular. Now, there's two things I want to make sure that we point out and talk about. One of them is called the renal portal system. Everybody's heard about this, and probably everybody's taught in school to be careful with the back legs of reptiles when you give drugs. Well, in fact, all reptiles have this renal portal system. All the blood that leaves the tail and the back legs goes through the kidneys before it returns to the heart and the general circulation. How does that affect our drug use? Well, let's go back to some basic physiology. When we talk about the clearance of drugs through the kidneys, there's two vascular sources. There's two ways that drugs are cleared from the kidney. So this, of course, is your nephron and your collecting duct. The first way that drugs are cleared is by glomerular filtration, and that's blood entering the glomerulus, the top of the kidney, and then leaving the glomerulus. The second way is through the peritubular capillaries, and these are vessels that wrap around the proximal tubule. Now remember, they don't have a nephron like dogs and cats do. So the two ways it's cleared is glomerulus and peritubular capillaries. Why is that important? Because the glomerulus is arterial, okay? The peritubular capillaries are venous. So there's two separate blood supplies to the kidney. There's the venous blood supply, which goes to the peritubular capillaries, and the glomerular filtration, which comes from the arterial supply. Why is that important? I'll explain that in a second. The next thing I want to talk about is to show you a diagram. So any blood that leaves directly from the heart goes through the aortas and goes directly to the kidneys. It bypasses the rest of the circulation first. But when it goes to the kidneys, via the arteries from the aorta, it goes to the glomerulus, so glomerular filtration. However, blood that leaves the tail, blood that leaves the back legs, also go to the kidneys, but they go to the peritubular capillaries. They don't go to the glomerulus. Okay? So only arterial blood goes to glomerular filtration. Only venous blood from the back legs go to the peritubular capillaries. It's extremely important to remember the distinction. Now, I also want to talk about the hepatic portal system, and then I'm going to tie all of this together so it makes sense. Okay, so I've injected iohexol, which is a contrast agent, into the tail vein of this iguana. As I said, blood that leaves the tail, it goes to the kidneys. Okay, if I inject it in the back leg, that would also go to the kidneys. After it passes through the kidneys, it goes to the vena cava, or it goes to the ventral abdominal vein, and both of those veins go to the liver. And that's the hepatic portal system. Then the blood goes back to the heart. So again, blood injected into the tail or the back legs goes to the kidneys first, through the general circulation, the ventral abdominal vein, the vena cava, then it goes to the hepatic portal system, then it goes to the heart, and then back to the general circulation. So once again, blood that leaves the heart via the arteries goes to glomerular filtration. Blood that leaves the tail and the kidneys goes to the kidneys first before it goes back to the heart. Right? That's pretty clear here. So graphically, it looks like this. So if you inject in the front legs, the blood will go to the precava. From there, it goes into the right atrium, then into the single ventricle. And the blood leaves the single ventricle to the lungs, where it's oxygenated. From the lungs, it goes back into the left atrium, goes back to the single ventricle, and then it goes out the aorta and bypasses the liver. Now it goes directly to the kidneys. I'm going to come back to that in a little bit and explain why that's extremely, extremely important after we talk about the drugs. So what I want you to remember, there are two ways that the drugs are cleared in the kidneys. One is by venous blood through the peritubular capillaries. The second one is by arterial blood through glomerular filtration. All right, so when you inject in the front legs, you have no first pass effect from the hepatic portal system. Whereas, let's go back a few pictures, and you can see if you inject it in the back legs or the tail, you have first pass effect through the kidneys, first pass effect through the renal portal system, then it goes to the heart and it gets spread through the body. So if we inject it in the front legs, there's no first pass effect from the hepatic or the renal portal system. All right, so keep that in mind. We're going to talk about some different drugs that we can use. There's not a lot of drugs that have been studied in reptiles, which is sad because we have a tendency to use the drugs that we know about in a lot of different species. And remember, the latest count, there's over 13,000 different types of reptile patients. Now, in your practice, you're probably only going to see maybe 20 or 30. You'll see your iguanas, your bearded dragons, your red-tailed boas, your pythons, maybe your skinks. You'll see some turtles. You're not going to see 13,000. So the good thing is, if you remember the few species that you see on a regular basis, it will help you decide what drugs to use. And then for those species that are new to you, get out the internet and look it up. Okay. What should we use? A couple things you need to remember. In our reptile patients, the vast majority of our pathogens are going to be gram-negative, not gram-positive. So it's important that we pick drugs that we know are going to be effective against gram-negative bacteria. The other thing that's important, whenever you get a chance, it's always good to do a culture and sensitivity. So clearly, whatever that drug is right there is very effective. These drugs here are intermediate. These drugs down here don't work. So we certainly don't want to pick these drugs if we're trying to treat a sick animal. We're going to want to pick one of these, right? So we need to know that these drugs work well in animals and they're very effective against the isolate. The other thing we have to talk about is whether we pick a static drug or a cidal drug. Now, for those of you that may not remember, there's two different ways that antibiotics kill pathogens. One of the ways an antibiotic kills a pathogen is called bacteriostatic. And what the antibiotic does is it doesn't kill the bacteria, it stops the bacteria from replicating, and it depends on the competent host immune system to kill the bacteria and get rid of it from the body. The other type of antibiotic is called bactericidal. Now that antibiotic actually kills the bacteria. So you can use that in a situation where you have a host that may be weakened or have a compromised immune system. So for instance, this desert chuckwalla is extremely sick, extremely depressed, has a very poor immune system. So you're not going to want to use a static drug in this animal. You're going to want to use a cidal drug. So keep that in mind when you're picking your antibiotics. Now, excuse me, there are a lot of published doses of drugs out there. And what I recommend you do is get the current literature and try and stick with drugs that have actually been studied. It's called pharmacokinetics. If we go back here, a lot of these published dosages, they've never actually been studied. These are just dosages that people have used and said, oh yeah, it works okay, but we don't really know how effective it is. So you want to try and get drugs that have been actually studied in the species. A couple good references, Reptile Medicine and Surgery, written by Divers and Stahl, and Carpenter's Exotic Animal Formulary. What's nice about both of these books is that they're digital, so you can get them online. You don't have to buy the actual book. You can buy just the digital subscription, And you can look it up on your smartphone or on your computer at work. So that's kind of nice to have. If money is a concern and you only had to get one book, I would say get the Carpenter's book, because that covers not just reptiles, but it covers all the exotic species. All right, let's talk about some of the drugs. And these are drugs that I have on my shelf. These are drugs I use on a regular basis. One of the first ones is going to be long-acting tetracycline or oxytetracycline. Not a lot of work has been done studying this in reptile species. It's a static drug. So again, as I mentioned, if you have a very weak or very sick reptile, you don't necessarily want to use a static drug. You want to use a cidal drug. Tetracyclines are effective against a lot of the gram-negatives, but they're not effective against Pseudomonas, Klebsiella, Citrobacter, some of the really nasty ones. They are effective against anaerobic gram-positives, and that's important because I'm going to get back to that later. Anaerobic bacteria are very common. Now, probably where the tetracyclines come into the biggest use are some of these atypical bacteria. And what I'm talking about are Mycoplasma, Chlamydia, and Rickettsia. These are really common, and they're hard to find when we do our sensitivity testing, because most laboratories can't culture for these very effectively. And a lot of these bacteria, like Mycoplasma, can take sometimes 6 weeks to culture on a plate. So many times when we're treating things like Mycoplasma, we're doing it based on the species, based on our knowledge, and based on the clinical symptoms. All right, tetracyclines are cleared by the kidney and hepatic elimination. They're actually metabolized in the liver. Why is that important? Because remember, drugs that are cleared by the liver, you can't give them in the back legs. One study that was published using oxytetracycline is in alligators, and they recommend 10 milligrams per kilogram every 10 days in the front legs. Now, don't worry if you don't get these doses down, because all of these doses are listed in the Carpenter formulary and in the reptile medicine and surgery book. Tetracyclines are also extremely useful for Mycoplasma infections in tortoises. Now, it hasn't been studied in tortoises, so I would use the same dose, 10 mg per kg, usually about once a week. And that seems to work pretty well, even in tortoises. But keep in mind that drug has not been studied in tortoises, but I can tell you from experience, and I've been doing this for a long time, it does work very well for Mycoplasma in tortoises. Chloramphenicol. This is a drug that used to be very popular, and it's not as popular anymore because it's an older drug, but it actually works extremely well in reptiles that are properly warmed. It interferes with protein synthesis. Now, generally, it's a static drug, but at higher concentrations, it's actually cidal. So even in some of our patients that are extremely weak, we can use chloramphenicol because if we use a high enough dose, it's a cidal drug. Like tetracycline, it's biotransformed in the liver, so that means we don't want to use the back legs. And the dose in the literature right now is 50 mg per kg once a day. That's a really, really high dose. So if you've got a large animal like a really big snake or a really big alligator or a really big tortoise, it's almost impossible because you have to give so much. So it's a difficult drug to give. Plus, chloramphenicol has some side effects in humans. So if you use it, you have to wear a mask and you have to wear gloves. And generally, it's not recommended that women handle it because women can get aplastic anemia if they're exposed to chloramphenicol. So that's one of the reasons it's not used that much anymore. Sulfa drugs are really good. They come in injectable and oral forms. I like them because they can be given orally, and I'll frequently send them home with clients. They're broad spectrum. These are a combination drug. It's sulfamethoxazole and trimethoprim. So the two drugs together are cidal. Each drug by themselves are static, but when you combine the two drugs together, they become a cidal combination, and they're very, very effective. The drugs are conjugated in the liver, and then the conjugates are excreted in the kidneys. So because they're conjugated in the liver, you really don't want to give it in the back leg if you're using injections. But if you're giving the oral form, it doesn't matter. The dose is 30 milligrams per kilogram, intramuscular or orally, given once a day. Penicillins, these are older drugs and not used very much anymore, but they do have some specific purposes. And they're broad spectrum. They interfere with cell wall synthesis. They are cidal drugs, which is good to know because you can use them in animals that are weak. Their most efficient use is with anaerobic bacteria, not so much with gram negatives, okay, but with gram positive anaerobes. Now, some of the newer penicillins are secreted by glomerular filtration, but most of the penicillins are secreted by tubular secretion. So that means you don't want to use the back legs. And the dose is 22 mg per kg once a day in the front legs. Now, a doctor named Jim Stewart back in 1990, so 30 years ago, did a study. And he looked at 65 random isolates from sick reptiles. And he found 54% of all the sick reptiles not only had aerobes, but they had anaerobes. Why is that important? Because that means bite wounds, like this snake that was bitten by a rat. Now, the mouth is full of Bacteroides, Fusobacteria, Peptostreptococcus. These are all anaerobes. So if you give some of these drugs like Batril and aminoglycosides, they don't touch anaerobes. So another thing is he looked at pneumonia, and this was in a chameleon. And in the pneumonias, 54% of all pneumonias also had an anaerobic component. So that means some of these patients that you're treating, let's say with Batril, and they're not getting better, it's because you're not treating the anaerobes. And that's where adding in a drug like penicillin is really beneficial. Another drug, which is a little more useful than penicillin, a little more popular, are the cephalosporins. They're broad spectrum. They interfere with cell wall synthesis, so they're bactericidal. You can use them in weak animals. And their excretion varies depending on which cephalosporin you're using. The original cephalosporins, the first generations, are mostly tubular secretion, but the newer generation cephalosporins are glomerular filtration. So ceftazidime has come into real popular use in reptile medicine. It's a third generation cephalosporin, broad spectrum, interferes with cell wall synthesis. It's a cidal drug cleared by the glomerulus, so you can use the back legs if you want to. 20 mg per kg every 3 days. That makes it a very, very efficient drug to use in reptiles because you only have to handle them once a day, and you can give the injection in the back legs and in the front legs. It's used frequently in orthopedics because not uncommonly we use it preoperatively to cut down potential orthopedic infections, because a lot of times the infections that we see with orthopedics are secondary to gram-positive bacteria on the skin getting in around the pin sites. So cephalosporins are frequently given preoperatively in a lot of these cases. Now, there's a drug I want to point out, and I know you have it in Mexico, and it's called cefovicin. And in the United States, it's gone by name Convenia. The reason I want to point it out is in dogs and cats, it's a very long-acting drug. It can last up to 10 to 12 days. However, it's been tested in reptiles, and how long do you think it lasts in reptiles? Well, there have been several studies. In iguanas, for instance, it lasts less than a day. In fact, it only lasts about 4 hours. So all the researchers now are saying cefovicin, which used very well in dogs and cats, should never be used in reptile patients. That's important to know. Now, saying that, there is a drug that's used in cattle that's been studied in reptiles. It is a long-acting drug. Ceftiofur is a third-generation cephalosporin. It's cidal, inhibits cell wall synthesis. It's effective against gram-negative. It doesn't get Pseudomonas klebsiella, but it does get a lot of the other gram-negatives. It's effective against most gram-positives, and it's effective against a lot of the anaerobes. It's cleared by the kidneys, so it can be given in the back legs, but they recommend actually giving it in the muscle over the neck. So that's where they recommend giving it, is even though it is cleared by the kidneys, they recommend giving this in the neck muscle. And the dose, depending on if it's a lizard or a snake, in lizards, they recommend 15 milligrams per kilogram IM every 5 days. And in snakes, 30 mg per kg IM every 12 days. So again, this is a nice cephalosporin that lasts quite a long time. almost to the end of the drugs here, and aminoglycosides. These are the most important drugs you're going to use for gram-negative bacteria. And they're the most important drugs that they use in humans in gram-negative septicemia. They don't do anaerobes. So remember, 50% of all infections have anaerobes. So oftentimes you have to use aminoglycoside with something else. It's a cidal drug, so it can be used in animals that are weak, cleared by glomerular filtration, so it can be used in the back legs. And they require 5 mg per kg in the first dose, and then only 2.5 milligrams per kilogram every 3 days. So again, like ceftazidime, it's only given every 3 days. It's a very safe drug, a very easy drug to give. It's used a lot in gram-negative septicemia in reptiles. It can be used in gram-negative septicemia in amphibians. Extremely good drug. These animals need to be warm and they need to be properly hydrated, because if not, the aminoglycosides can be very hard on the kidneys and they can cause something called gout. So these are gouty crystals caused by aminoglycosides. This is pericardial gout. These are crystals in the heart, and these are crystals in the kidneys. So with the aminoglycosides, it's extremely important that they're warm and they're hydrated well. Finally, we're going to end up on fluoroquinolones. Everybody knows what Baytril is. It's a GNA gyrase inhibitor. It's cidal, very broad spectrum of activity. It's cleared by the glomerulus, 5 mg per kg once a day or 10 mg per kg every other day. Since it's cleared by the glomerulus, you can go ahead and give the back legs. There's also a newer drug out called danofloxacin, and this is used in large animal medicine. It's been studied in sea turtles. It's very effective against gram-negatives like Pseudomonas. It gets mycoplasma, 6 mg per kg IM in the front or back legs every 48 hours. Extremely good drug to use. And finally, I just want to talk about anaerobic bacteria. Metronidazole, which we all use for protozoans, excuse me, can also be given. It's extremely, extremely effective, 100% effective against anaerobic bacteria, 20 to 40 mg per kg once a day. I like to stick to the lower dose because oftentimes metronidazole at the higher dose can cause neurologic signs. So properly warmed, properly hydrated, 20 mg per kg once a day. All right. So what happens when somebody brings you an animal that's sick? They don't have any money. They don't want to let you do a culture and sensitivity. So what are you going to use? You need to make sure you cover all your bases. And remembering the Stewart study about the anaerobes, I would usually pick an aminoglycoside or a fluoroquinolone as my main drug of choice for my gram-negatives. So aminoglycoside or Baytril. And then you add into that a penicillin, a cephalosporin, or a metronidazole. So this gives you your gram-negatives, this gives you your gram-positives, and your anaerobes. So gram-negative, gram-positive, and anaerobes. So in summary, these are some of the common drugs that we use. How are they eliminated? Make it real easily. GF is glomerular filtration, that's arterial. TS is tubular secretion, that's venous. So here, trimethoprim sulfa, that's a combination drug. It's cleared by glomerulus and tubular secretion. And remember, chloramphenicol is cleared by the liver. So are they affected by the hepatic or the renal portal system? If it's glomerulus, no. If it's tubular secretion, yes. If it's hepatic, yes. So can we use the back legs? If it's glomerulus, yes. If it's tubular secretion, no. If it's hepatic, no. So that pretty much sums it up. What we can do now is we can open it up and I can take some questions for a few minutes, okay?
Thanks a lot, doctor. It was an excellent presentation.
Thank you.
Bueno, ¿alguien quiere hacer alguna pregunta para el doctor? Puede ponerla en el chat y ya se la traducimos al doctor. Igualmente, Aranza, si hay alguien en Facebook que haya hecho alguna pregunta o comentario.
Hasta ahorita no, doc, todo bien.
Perfecto, gracias. Dr. Santi Molina says that thanks a lot. Just one person tried to answer the last question, that was Carlos Gutierrez, that he says enrofloxacin maybe, so he was correct, or kind of correct at your last question. Jorge Iván Hernández Arteaga asks, in case of corneal ulcera, what did you recommend?
Good question. For corneal ulcers, you should treat it both topically, and you can use eye drops like gentamicin eye drops, or you can get ciprofloxacin eye drops. And then you should also treat it systemically, and you can use gentamicin injections, or you could use something like a Baytril injection. So you want to treat from the outside topically, and you want to treat from the inside. That's probably the most efficient way to do it.
Thank you. Iván, el doctor dice que se tendría que tratar de ambas maneras, de una manera tópica y de una manera sistémica, pudiendo utilizar algunos fármacos como gentamicina o quinolonas, pero pues él sugiere el abordaje en conjunto, ¿no? Tanto tópico como sistémico. Doctor, Saldaña Rodríguez Montserrat asked if you could repeat again about why don't use Convenia.
Because Convenia, the reason it lasts so long in dogs and cats is because it's protein bound. And the particular protein in dogs and cats keeps the Convenia in the system for 10 to 12 days. Reptiles don't have that protein. So if you give Convenia to an iguana or a boa constrictor, they don't have the right protein to bind it, and so it's immediately cleared from the kidneys.
Montserrat dice el doctor que justamente es por la unión a las proteínas, que en perros y gatos es lo que permite que pues el Convenia pueda tener una acción de más de 12 días, mientras que en los reptiles pues que carecen de estas proteínas no se pueden, no hay vida media del medicamento hasta por más de 4 horas, o sea que no es una opción viable justamente para tratamientos largos, que sería la ventaja del Convenia, por lo menos en mamíferos. Here's a comment, doctor, from Carlos Gutierrez. He says, Doctor, I'm a big fan of all your work. It's a big surprise for me to see you for the first time live at a conference from my university. Here at Mexico City, it's really common to find reptiles with metabolic bone disease, a wide variety of trauma cases, and respiratory diseases. I want to ask you, doctor, what about pain treatment?
Oh, it's a very good question. You know, there have been a lot of studies done on pain in reptiles, but honestly, we don't know enough about how reptiles feel pain. So it's hard to say what the best drug is. What I use is something called ketofen, K-E-T-O-F-E-N. I use 1 milligram per kilogram once a day. That's my go-to drug. Do you have ketofen in Mexico?
I think not. I want if some of our assistants can help me to answer this. Carlos says carprofen and meloxicam, maybe not ketofen.
Okay, well, you can use meloxicam too. I wouldn't use carprofen. It's an older non-steroidal, and it's a little bit hard on the kidneys in reptiles, but you can certainly use meloxicam. And the dose is 0.1 milligram per kilogram once a day.
Okay, thank you, doctor. Adriana Ortega says, I would like to know if the doses of treatment, it should be changed if it is administered by mouth.
Oh, that's a good question. No, you don't have to change the dose if it's given by mouth, as long as the patient is properly warm and properly hydrated. If you warm them up, they respond like a mammal. If they're cold, they won't absorb it. So you don't have to change the dose.
Okay, thank you. La doctora Samantha Jardón asks, well, it's a commentary and a question. First, congratulations for your presentation, and
Thank
then
you.
how about antibiotic resistance in reptiles?
Well, we do see antibiotic resistance in reptiles, especially with certain bacteria, because some bacteria more than others. Salmonella, which I know you've all heard of, is one of the bacteria that has the ability to make resistance very easy. So it's extremely important when you're doing any treatment with some of these diseases that you get sensitivity data. Otherwise, you probably will develop resistant bacteria.
Thank you. Doctora, el doctor comenta que, bueno, es importante en el caso de Salmonella, es una bacteria que está causando muchos problemas de resistencia, por eso es importante todos los estudios que se puedan hacer sobre el uso de los antibióticos y, bueno, específicamente para los clínicos, que hagamos los antibiogramas para poder saber qué antibiótico es el adecuado. Dr. Santi Molina asked, sometimes when we work with wildlife, we found many bacteria. When we do cold chips, but we don't know if we have to treat it.
Well, again, it's real important that you know what the bacteria is and where you found it. So you don't have to treat every bacteria. As I mentioned in the beginning, if I find salmonella in the lung or in the blood, I'm going to treat it. If I find salmonella in the gastrointestinal tract, I'm not going to treat it because it's part of their normal flora in the gastrointestinal tract.
Thank you. Eric Alvarez asks, which could be one of the best antibiotic treatments in cases of stomatitis in serpents?
In a perfect world, you want to do a culture first. If you don't have the ability to do a culture, I would probably use aminoglycoside like amikacin, and then I would add into that a cephalosporin like ceftazidime, because frequently you're going to get gram-negative in the mouth, but you'll oftentimes get anaerobes at the same time.
Thank you. Adolfo Ortiz asked, Doctor, thank you so much for your presentation. In case of giving fluid therapy, how long will you keep both the fluids and temperature for us to know when it's right to start on antibiotics?
24 hours.
Okay, thank you. Adriana Ortega has another question. Also, I would like to know if there is antibiotic that should be administered to breeding females.
Oh, wow, that's a very good question. Nobody has ever studied that. So I can tell you that I have used amikacin in breeding snakes, breeding turtles, and breeding lizards, and they've still had normal eggs and normal hatchlings. But nobody has ever actually studied that. So there's no published papers on antibiotics in pregnant animals.
Thanks a lot. It was a good question. Carlos Gutierrez and la doctora Samantha Jardón says, thank you a lot, Dr. Mader. Uriel Sanchez asks, in patients with undiagnosed kidney damage associated with severe dehydration, you recommend to avoid the use of antibiotics?
That's a very good question too. Your audience is very smart. If you have a reptile that's sick, they're most likely not going to be eating well. And if they're not eating well, they're what's called catabolic. And that means they're starting to lose weight, and that adds to their uric acid load, which can damage their kidneys even more. So if you pick an antibiotic, you really should pick an antibiotic that is not cleared by the kidney, So I would use something like chloramphenicol, or perhaps you have to be careful with certain drugs like the sulfa drugs, because they can really damage kidneys. Aminoglycosides are really dangerous in kidneys. Baytril can be given to animals with kidney disease, but you probably should cut the dose in half, because Baytril has been known to cause kidney disease too if they're dehydrated. So it's extremely important that they're warm and hydrated before you pick any antibiotic. But I would definitely stay away from sulfas, and I would definitely stay away from the aminoglycosides.
Thank you, doctor. And the last question here on the chat comes from Norma Berenice Cruz Cano, and she said, what will be the best treatment before and after a surgery?
If it's a routine surgery, I like to put them on ceftazidime, because that's a very good preventative, and it gets all your gram positives. It gets, anaerobes, and it gets gram negatives, but usually surgery, you don't have to worry about gram negatives. It's the gram positives from the skin. So I start them with ceftazidime before the surgery, and then I usually give them 3 doses after surgery.
Okay, thank you. Eric Alvarez says, thank you so much, doctor. And there's one other question from Jorge Ivan that says, in case of old and young patients, doses are managed the same as in mammals?
That's another excellent question. And the thing is, nobody's ever studied that in reptiles. So to answer your question, I would keep the dose the same. As long as they're warm and they're hydrated, I wouldn't change the dose at all. Sometimes I'll alter a dose if I'm treating a different size patient. In other words, if I'm treating an iguana versus if I'm treating an alligator, a big alligator or a big crocodile, I'm going to use a lower dose in the larger animal just because of metabolism. So as far as age goes, yes, you probably should adjust the dose, but nobody's ever studied it. So I can't sit here and tell you the best way to make the adjustment.
Okay, thanks a lot, doctor. And Uriel Sanchez and Norma Berenice says, thanks a lot, congratulations. Aranza, ¿hay alguna pregunta en Facebook?
Sí. The question came from Wanda Serre. How can we know the percentage of the dehydration in reptiles?
I didn't understand your question. I'm sorry. The percentage or what?
The dehydration.
I'm sorry. I still don't understand your question.
¿Me la podrías decir en español, Aranza?
Sí. ¿Cómo podemos saber el porcentaje de deshidratación en reptiles?
Okay. The question is, doctor, how can we know how's the hydration percentage in reptiles?
I'm so sorry. I still don't understand what you're asking me. My bad.
No, sorry. Maybe it's
percentage. What percentage are you talking about?
How we can know how much dehydrated is our patient? How percentage?
Are you saying dehydrated?
Yes.
Okay. The best way to tell is to take a blood sample and look at the packed cell volume and look at the total solids, because you can't really assess dehydration based on skin like you do in dogs and cats. So a very simple, quick blood test, and spin down a hematocrit tube, look at percentage of hematocrit, and look at the total solids. And if the total solids are high and the hematocrit is high, good chance it's dehydrated.
Okay, thanks a lot.
Okay, we'll take one more question, okay?
Okay. One more question, Aranza, please.
No, hasta ahorita nada más fue esa.
Okay, that was all, doctor. It was the last question. we are very happy and we have for having the honor to be with us. It was an excellent conference. I think that everybody learned a lot and a lot of questions was very well. So thanks a
Well,
lot.
thank you very much. And if you have any other questions, you can email them to me tomorrow, okay?
Okay, thanks.
All right, buenas
Thanks a lot, doctor.
noches.
Buenas noches, doctor. Muchas gracias por su apoyo. Entonces, chicos, estimados asistentes, con esto finalizamos la sesión del día de hoy. Creo que fue una sesión bastante fructífera a pesar de haber sido relativamente corta, pero pues bueno, creo que fue de bastante utilidad. Entonces, pues bueno, nos vemos el día jueves para nuestra siguiente plática. Muchas gracias a todos por su participación y nos vemos el día jueves. Hasta luego. Buenas noches.